The menstrual cycle characterizes the work of the female genitals and the secretion of female hormones every month. It includes several phases, each with its own role. It is also from the menstrual cycle that a woman can determine her ovulation and therefore the best time to conceive a child. The menstrual cycle is variable from woman to woman, from 3 to 7 days, like pain and premenstrual symptoms. The menstrual cycle, what is it for? It corresponds to an average duration of 28 days. It can vary between 21 and 35 days on a normal cycle. 28 days during which, female hormones such as ovarian work will evolve in several characteristic stages. Having regular cycles is therefore having your period every month on the same date. A regular menstrual cycle is also a sign of optimal functioning of the ovaries and therefore the possibility of easily and naturally conceiving a child. The menstrual cycle and premenstrual syndrome. Under the effect of estrogen and progesterone hormones, some women experience side effects before their period due to the development of their menstrual cycle. Thus, irritability, swollen and painful belly, bloating, headaches, vision problems, eating disorders, disgust or cravings, painful breasts, all signs that evoke premenstrual syndrome. Suddenly, this phenomenon associated with the evolution of the menstrual cycle can be reduced by taking homeopathic medicines in particular. Duphaston is also often indicated to reduce the effects of premenstrual syndrome. The menstrual cycle in practice. The first day of a woman's menstrual cycle is the first day of her period. During the menstrual phase, cervical mucus is scarce and opaque. Before ovulation 5 days after menstruation, the inside wall of the uterus, called the endometrium, thickens to be able to accommodate the future embryo in the event of fertilization, in particular thanks to the secretion of estrogen. The follicular or preovulatory phase, evolution of the oocyte. The first day of menstruation also marks the start of the first phase of the cycle called the follicular phase. During this phase, the estrogen level will increase, the endometrium, that is to say the lining of the cervix, will thicken. At the end of the follicular phase, an egg is expelled by a follicle. In the process, ovulation occurs. Either the egg is fertilized and there is implantation, or there is no fertilization. Cervical mucus becomes translucent. The ovaries themselves prepare to generate an egg and secrete hormones, progesterone and estrogen. Ovulation. Ovulation usually takes place on the 14th day after menstruation on a 28-day cycle. The mature oocyte is released by the ovary, it is then aspirated by the fallopian tube. The egg is ready to be fertilized by a sperm. The luteal phase. The last phase of the menstrual cycle is called the luteal phase. During this phase, progesterone is secreted just after ovulation. If there is fertilization, its rate remains high. If, on the other hand, the egg is not fertilized, the progesterone level drops. The uterine lining then peels and menstruation occurs. In the other case, both progesterone and estrogen continue to increase in levels. The egg is implanted, this is called implantation, and the pregnancy begins. Very quickly, the HCG hormone is secreted. The woman is fertile only for 4 days, 3 days before ovulation and 1 day after it. If there is no fertilization, the endometrium degenerates and menstruation occurs and so on. The menstrual cycle and female hormones. Besides progesterone and estrogen, the ovaries are also controlled by the hormones FSH, follicle-stimulating hormone, and LH hormones, luteinizing hormone, produced by the brain. FSH is secreted in first day of menstruation to stimulate the ovaries. FSH promotes estrogen production and egg maturation. LH is secreted a few days before ovulation. Very abundant in the blood to 14th day of the cycle, it shows a successful ovulation and progesterone secretion. This last hormone is responsible for the thickening of the uterine wall, which will accommodate the embryo. The menstrual cycle, how long does it last? Every woman has menstrual cycles until the famous menopause. Around age 50, the periods disappear and therefore the woman no longer has a menstrual cycle at all. Irregular menstrual cycles. Having irregular menstrual cycles is often a testament to problems with ovulation. Lack of ovulation or poor quality ovulation leads to difficulty conceiving. This is why it is important to observe the length and frequency of her menstrual cycles early on. Bleeding outside of your period also indicates a dysfunction of the menstrual cycle. Making temperature curves is a first step in detecting an anomaly in its cycle. The menstrual cycle, how the female genitalia works. If the vagina is undoubtedly the most famous intimate part, you should know that the female genitalia is not limited to this organ. Also necessary for reproduction, the ovaries. The woman has two. These are her sex glands, which produce the female hormones in the eggs. Each ovary is connected to the uterus by a tube. These are the famous fallopian tubes in which the sperm race to reach the egg. It is also the fallopian tubes that carry the egg to the uterus. Finally, the uterus, whose cervix is 3 centimeters long, is the organ through which menstruation pass each month. The uterus serves as a cavity to accommodate the embryo and then the baby for 9 months. Flexibility and suppleness are the main qualities of the uterus.